The screencast is about theoretical perspectives. Now, you should have taken general psychology or intro to psychology, so you should know that the field of psychology is made up of a number of different theoretical perspectives, whether we're talking about, the Freudians or the humanistic psychologists, the neo-Freudians, the biological perspective, sociocultural perspective. There's lots of different perspectives. So when we talk about abnormal behavior, what we're really trying to do is develop an orientation to understanding that behavior so we know what the potential cause is of the psychopathology or abnormal behavior. And then from there, if you have an understanding of the cause, theoretically, you can develop a treatment based on your understanding of that disorder. So, each different psychological perspective will look at different types of psychopathologies in different ways. Now, the first one that we're going to start with is a biological perspective. Now, me personally, this is the perspective that I use most frequently in my conceptualization of psychological disorders. I mean, my training's in neuropsychology. I think that most psychological disorders are diseases of the brain. However, I utilize some other perspectives as well, especially when it comes to therapy. So let's talk about the biological perspective a little bit. The first thing is that the biological perspective assumes that disturbances in emotions, behaviors, and cognitive processes are caused by abnormalities in the functioning of the body, which would really be the brain. So what we're talking about when we look at the brain, one of the ways that you can talk about how the brain works is structure or function, and one of the ways that the brain functions is with neurotransmitters. So neurotransmitters are chemical substances that are released from a neuron into a synapse, and then they act in the synapse by crossing the synapse and communicating with the postsynaptic neuron on receptor sites. There's an example here. So this would be like the presynaptic neuron. Information flows this way. These would be the neurotransmitters that are released from vesicles that fuse with the cell wall here, released into the synapse, this space here, that travel down and interact with the postsynaptic neuron, this thing right here. And there would be receptor sites here that the neurotransmitters bind to and cause some sort of action in the postsynaptic neuron. So you should know these. I mean, I'm not going to spend too much time on them, but norepinephrine, serotonin, GABA, dopamine, acetylcholine, and opioids are all related to different psychological disorders. Now, I'm sure you've heard people say, oh, that person has a chemical imbalance. And we like to theorize that disruption in these neurotransmitter systems are causing the psychological problems, but saying a chemical imbalance is, it's actually one of my pet peeves. There's no way to measure your levels of neurotransmitters. And we don't really know if that's what's causing the psychological symptoms. It's just a theory. And really what you do when you introduce medications for psychological disorders, all medications will either increase the activity of these neurons, like an SSRI, like Prozac, will increase the levels of serotonin in the synapse, or they'll block the function of the neurotransmitter. So let's take dopamine, for example. We can stimulate dopamine in the synapse with a drug called methylphenidate or Ritalin for ADHD that will increase levels of dopamine in the synapse. Or we can use a drug like Thorazine for schizophrenia that will block dopamine receptors, so it'll reduce the activity of dopamine. There's drugs available that do that with all of these neurotransmitters, and They're psychoactive drugs, so they have an effect on the brain. We can also look at genetics. So genetics are very important. Soon, I think that we will see a genetic basis for many of the psychological disorders, but it's going to be an interaction between genes and environment. So it won't just be straight genes for most disorders. There will be a handful of genes that kind of cluster together, and then with the right environmental influences, you'll see the expression of the disorder. That's called epigenetics. So with the relationship between genes and environmental influence, what we look for is gene and environment correlations. Another title of that is called the diathesis stress model. So you should know that. The diathesis is like a genetic predisposition, and then stressors are anything in the environment that has the potential to throw the body out of homeostasis or balance, or trigger the stress response, depending on how you want to look at that. And so you have a genetic predisposition, you have the right environmental factors, you'll have the expression of the disorder. When we look at the contributions of genetics to psychological disorders, we use different methodologies. We can look at family inheritance studies, DNA linkage studies. We can look at genomics combined with brain scans. We can look at twin studies. There's all sorts of different things that we can do. When we move into treatment from the biological perspective, we're really looking at medications, surgery, or manipulation of the brain in some way. There's a couple ways to do this. There's deep brain stimulation, which is also called neuromodulation, or electroconvulsive therapy. Now, at this point, you should go, whoa, wait a second. Psychosurgery? What is that? Now, you should be familiar with the lobotomy. Monaz was famous for developing the procedure of the lobotomy. He won a Nobel Prize in medicine. But it's no longer used today. There are still psychosurgeries that are in use, though, like a cingulotomy. That's used in severe obsessive compulsive disorder. Deep brain stimulation, most frequently you'll see that in neurological disorders like Parkinson's disease. And then electroconvulsive therapy, it really works. We reserve this, however, for patients typically that are suicidal and have failed all other medications. So it's kind of a last resort. But what happens is when you use electroconvulsive therapy, I think I have a slide of this, you put electrodes on either side of the temporal lobe, and the patient has a seizure. Now, one thing that doctors have noticed for a long time is that people that have psychological disorders, after they have a seizure, they have a reduction in symptoms. Now, back in the day in psychiatric hospitals a long time ago, they would pump people full of insulin. So they would have a diabetic seizure. And that was one way that they would try and treat psychological disorders. We no longer do that. However, this does work in the most severe cases. But there's also, think about somebody that is profoundly depressed. Maybe they're suicidal, and let's say they have bipolar disorder. And the treatment for bipolar disorder, one treatment is lithium, the drug lithium. Lithium can cause birth defects. So if you have a patient that's pregnant, they can't be on lithium. If they go into a depressive state, a major depressive episode, and they're suicidal, this might be a treatment of choice because it's not going to affect the developing child in any way. There's so many medications, it's ridiculous. I actually like medications. If, and let me say that again, if they are used the right way. So currently, the medications for psychological disorders, unfortunately, I think they're oftentimes misused, abused, used totally incorrectly. However, with the right training and the right approach to using medications, they can be incredibly helpful. Now, obviously, I'm a psychologist. I can't prescribe medication, but I did the training for psychologists to be able to prescribe medication. Psychologists can prescribe in Louisiana, New Mexico, and in the military. So here's some categories of drugs that are used to treat different disorders. You can see there's all sorts of different types of drugs that are available within each category of disorder. You'll see a number of different categories of medications. We'll talk about those more in detail. But really, the medications for psychological disorders have really been around only at this point for about 60 years. So in the 1950s is when you see the release of the first drugs to treat schizophrenia, like Thorazine, and this led to the deinstitutionalization movement in the United States. We shut down huge numbers of state psychiatric facilities in favor of the medications. So we look at this old ad for Thorazine, and it says, when the patient lashes out against them, Thorazine quickly puts an end to his violent outbursts. And that seems ridiculous, but this is a recent ad for Abilify. Abilify is in a similar category of drugs. And here, Abilify, navigating the road ahead with Abilify. And I mean, that's a drug to treat schizophrenia or bipolar disorder. They do have an FDA indication for treatment-resistant depression, but that's a heavy-duty drug. Okay, now we're out of the biological perspective and into trait theory. We'll cover this really quickly. Trait theory looks at different personality traits and how the combination of those traits can cause psychological disorders. For me, this really works best for the personality disorders. You'll know a personality disorder when you come across it in diagnosis because it will say personality disorder, like antisocial personality disorder or borderline personality disorder. This would be the 5-factor model of personality. So you have 5 factors, and then you'll have the opposite as well over here. So extroversion, and then there would be introversion. Agreeableness over here versus disagreeableness. Conscientiousness versus like self-centeredness. Neuroticism versus stability. And openness to experience or closed to experience over here. And if you vary back and forth with those traits to see where you fall, the idea is that we can tell, we can understand why you would have the personality problems or the personality type that you have. The psychodynamic perspective, obviously, you have heard of the psychodynamic perspective if you've gotten to this point. That's your buddy Sigmund Freud. So psychoanalytic was the therapeutic aspect of his theory. Psychodynamic is the theory itself. So Freud started publishing right at the end of, or at the beginning of the 1900s. If you remember, he theorized that the mind had 3 structures: the id, the ego, and the superego. And he said that the mind is like an iceberg, that only 10% of it is conscious, and that 90% is unconscious. And those driving factors are the id, that works on the pleasure principle, the ego that works on the reality principle and the superego that works on the morality principle. And so the ego has to balance these two things out. So let's say I want to eat some chocolate. That would be the id. And then my superego would go, but wait a second, you're on a diet. You can't have that. So this is like the morality principle. And these two things fight it out, according to Freud. But you've got the ego in the middle that tries to balance these two forces. And your ego would compromise and say, well, we'll just eat a small bar of chocolate. Freud also proposed defense mechanisms. So when you... Let's actually go back here. When impulses from the id start to like bubble up to consciousness level, the id is really driven by sex and aggression, according to Freud. And the id impulses are oftentimes sexual or violent. And when you start to become conscious and aware of the id impulses, that causes anxiety, according to Freud. And so defense mechanisms are in place to keep those unacceptable thoughts or instincts and feelings out of consciousness awareness and protect the ego against the anxiety that is caused by the id. There's all sorts of different defense mechanisms. If you don't remember these, look them up. So repression is like pushing the material back down into the unconscious. Displacement is taking your anger or aggression out on a safer target. So let's say you had a terrible day at work and your boss, well, actually, let's not say you. Let's say your spouse had a terrible day at work. Their boss was super mean to them. They come home and they yell at you, or they yell at the kids, or they yell at the dog. You, the kids, or the dog would be a safer target for them to displace their anger and aggression on. Sublimation is the only healthy defense mechanism. Remember that. If you don't know why, look it up. And then Freud also developed the psychosexual stages. And this is a normal stage of development through which each individual passes between infancy and adulthood. You should remember that. That's like the oral, anal, phallic, oral, anal, oral, anal, phallic, latency, and then genital stage. Now, Freud's followers really, I mean, they got upset about a lot of stuff, but one thing was the sexual nature of Freud's theory, that, it was really like sex and aggression. And so they disagreed with Freud. Freud didn't like people disagreeing with him, and so you had a branching off of the Neo-Freudians. So these would be like people like Carl Jung, Alfred Adler, Karen Horney, or Erik Erikson. So there's Carl Jung, Adler, Horney. Honestly, her name, I've heard it pronounced like several different ways. Horney, Horney, Horny. However you want to pronounce it is fine with me. And then Erik Erikson. So the main goal of traditional psychoanalytic treatment is to bring repressed unconscious material into conscious awareness. One way that you do that is with free association. You've probably seen that on TV. There's some tricks to free association. Really, free association is laying on a couch and just talking and talking and talking. But you can also elicit that by saying, like, tell me the first thing that comes to your head after I say these words. Blue, car, dog. And there should be some themes that pop into your head. And then dream analysis. Freud considered dreams the royal road to the unconscious. And he would oftentimes have clients talk about their dreams. The dreams would have manifest content, which was like at face value what was in the dreams, but the dreams would have hidden messages, or latent content that would give you clues as to what was going on in the unconscious. Excuse me. That's Freud's actual couch there that he used. That although Freud was practicing in Vienna, he had to leave because of the Nazis, and his house later in life was outside of London. It's now a museum. You can go and actually see this couch. I went to see that a number of years ago. It was kind of exciting. Okay, the behavioral perspective. You should remember names like Pavlov, Watson, and Skinner. So here we use the principles of classical conditioning, operant conditioning, and social learning and cognition. We should have put a picture of Bandura in there for social learning, but I forgot to do that. So if this sounds unfamiliar to you, look it up. And what we do is we use these principles of learning to understand different psychological disorders. This works really good with anxiety disorders and phobias. And then for treatments based on learning theory, there's counter conditioning, systematic desensitization, contingency management, token economy, and participant modeling. So if somebody has developed an anxiety or a fear, you can use some of these techniques to counter condition. Let's say a kid is afraid of a dog. Well, you just reinforce them in front of a dog. Or systematic desensitization. Say like a little kid got bit by a dog, and the kid is now afraid of a dog. That would be classical conditioning. Okay? So, what we need to do is fix that. Well, one thing that you can do is you come up with dog stimulus, like on a scale of 1 to 10. 1 being kind of mild dog stimulus, maybe a picture of a dog or just a word dog. And then 10 being like actual contact with the dog. So you teach people relaxation techniques, and then you systematically introduce, like gradually, the dog stimulus in order to get them over their fears. Now, contingency management is based on, you do something, you get this reward. It's reinforcement. So operant conditioning. Token economies utilize tokens instead of a direct reinforcer. So a secondary reinforcer versus a primary reinforcer. One of the people that pioneered that method is Nate Azrin. You can see him right there. Nate Azrin was actually my academic supervisor in grad school, and that picture was taken in Nova Southeastern University, where I went to school. Unfortunately, Dr. Azrin recently died, so it's kind of sad. He was really a pretty remarkable guy. So maybe in your class, I'll put a link to his obituary to kind of honor Dr. Azrin. And then participant modeling would use Bandura's techniques to model appropriate behavior. Like, let's say you have a kid with social phobia or something like that, or an adult, and they don't want to order a pizza because it makes them too anxious. Well, you would model the appropriate way to order a pizza over the telephone. The cognitive perspective. So cognitive perspective versus the behavioral perspective looks at thinking, and it would say that dysfunctional thoughts cause dysfunctional behaviors. The treatments there are cognitive restructuring or cognitive behavioral therapy. This is Aaron T. Beck, the father of cognitive therapy. He's retired now, but he still has some affiliations with the University of Miami. Although his name is Aaron T. Beck. T stands for Timothy, and his friends call him Tim. So Beck's theory is that dysfunctional attitudes, like people will probably think less of me if I make a mistake. So somebody will have that thought. That's kind of an ingrained thought. Well, everybody makes mistakes, and people probably really don't care about that. But this can be dysfunctional. So somebody would have an experience, they made a wrong answer in class or something like that, and then they would have an automatic thought based on this dysfunctional attitude, like, people think I'm stupid. And then that elicits a negative emotion. They get sad, feel useless, and may be depressed after that. The humanistic perspective, like person-centered therapy with Carl Rogers, client-centered therapy, self-actualization theory with Maslow. These are good perspectives. They really look at like the human side. Positive psychology kind of falls underneath this humanistic perspective now. And it really is an interesting way to look at psychology. A lot of self-help books actually utilize these theories and techniques. You probably remember Maslow's hierarchy of needs. So there's all sorts of different types of treatment interventions. One is using unconditional positive regard. There's another treatment modality called motivational interviewing that's really good with substance abuse clients. The sociocultural perspective emphasizes the way that individuals are influenced by people, social institution, or social forces. They assumed that abnormality is the cause of disturbances in the pattern of interactions and relationships within the family. So here's some dysfunctional families that you might recognize. And that social discrimination, social influences, and historical events are very important in the treatment. There's all sorts of different treatment modalities that are used in that approach. The biopsychosocial perspective is very important, and I want you to look at this. Biological, psychological, and social perspective. So the biopsychosocial perspective is an integrative approach to conceptualizing psychopathology. I mean, this is what I do. So every time I see a client, I write a biopsychosocial evaluation of that client and look at all the factors interacting. And most clinicians take this approach, and they select various aspects of various models and utilize what works for the client. So sometimes they'll also call that like an eclectic therapist. Oftentimes I'm a little cautious of people that call themselves eclectic therapists because, well, there's two presentations. One, they don't know what they're doing and they just kind of grab at straws here and there. But sometimes people that call themselves eclectic therapists really, really know what they're doing with a lot of different perspectives, and it can be very helpful. So when we look at all of these perspectives in psychology, I mean, we covered most of these. We didn't really cover evolutionary psychology. That's using the principles of Charles Darwin to explain behavior psychologically. It really gives us lots of different ways to look at problems. It makes things confusing, but it also helps us conceptualize from the various perspectives. So we're not looking at things from just one way. So keep that in mind. This is a difficult chapter, but after this we get into the actual psychological disorders. So as always, please do not hesitate to contact me if you have any questions or concerns.